Hello everyone. Good afternoon. Today is the fifth webinar in this series of webinars on mental health and good practice. Our topic today is the role of mental health professionals in supporting mental well-being programs and policies at school. And in this topic, we will talk about just a moment. We will talk about how we understand the landscape of mental health in school, about current challenges and trends in student mental health, about the role of mental health professionals working with students and staff in schools, and some our practice tools for accessing students' mental health. We are from Latvia. We work in Jelgavas gimnazija, and I am Judīte, Iliško. I'm school psychologist, and my colleague Santa Howard, she is social pedagogue. But today I will speak alone. But my colleague Santa is my good support in everyday life today, I will talk about our experience, Latvia's experience, and we would love to hear yours experience, because approaches are definitely different in every country, and we are support staff who works in a school environment, and we can share our experience. And our goal, like a support team, is a strong support system in the school environment, so that everyone, students, teachers, and parents, feel safe and well. And talk about understanding the landscape of mental health in school. About mental health. Mental health is a state of well-being in which a person is aware and realizes his abilities, overcomes daily stress, is able to work productively and successfully, and contributes to the development of his society. It says in the World Health Organization. But over the past 30 years, we know it, yes, mental health difficulties among children and adolescents have increased worldwide, becoming one of the main causes of disorder. And of course, mental health problems negatively affect various aspects of children's development, including school adjustment, ability to concentrate, general achievement, and social relationships. And in our country, when we talk about mental health in schools, is considered from three aspects. The first two aspects are protective factors of mental health. It's like social-emotional learning and vitality. We can say resilience too. The third factor is related to the reduction of social, emotional, and behavioral problems. And what does it mean, social-emotional learning? Social-emotional learning is a process by which children and adults understand and regulate their emotions, set and achieve positive goals, feel and show empathy for others, establish and maintain positive relationships, and make responsible decisions. Vitality or resilience is the ability to overcome and successfully adapt to challenges and difficulties. Social, emotional, and behavioral problems make up a wide range of difficulties. Such behavior does not correspond to social accepted norms for a child of a certain age. Such problems can manifest themselves in internalized behavioral or externalized behavior and risky behavior. This model shows and helps to explain how important the school environment is to form a meaningful, comprehensive model that helps to improve the mental health of both students and teachers, and thus improving the mental health of the whole society, because children are, our future. It is important that policymakers are aware of this and support it. Both prevention and promoting are important. Prevention and strengthening of resources are needed for all students, not just those we identify as needing help. Our approach in Latvia. We need to collaborate between students, teachers, families, heads of educational institutions, policymakers, and other stakeholders plays an important role. Our approach emphasizes the role of systematic collaboration in ensuring the psychological well-being of students and teachers. Inclusive approach, promoting the active involvement of students in school life, including students with temporary or mild mental health difficulties. Support is provided, taking into account the cultural values and experiences of all students, including different social-emotional backgrounds. Quality teacher education and support. This promotes teachers' own mental health and their social-emotional skills and helps develop methods for promoting the psychological well-being and of students and families. Active family involvement. Schools and families work together to develop children's mental health skills together. This can only be possible if school and families speak the same language and set common goals. Educational institutions in Latvia are increasingly aware of their role and mission in promoting the positive development, mental health, and well-being of children and young people. In order to build a mentally healthy society, we need to understand that mental health is at the core of how we feel, relate, and act, and that seeking help is normal. And we want that children know that sometimes it is normal not to feel good, and it's okay to seek help. And we want to, and we want that they knew this. That they can ask for help in school environment. Yes, yes. Yeah, yes. But when we talk about current challenges and trends in the mental health of students, we need to look on world situation too, and in our situation in Latvia too. Yeah, there is some challenges I will talk about a little bit of each of them. And public health indicators here in our country, in Latvia, are significantly behind as other European Union member states. At the same time, a significant improvement of public health indicators in the country is possible only if public health is included and strengthened in our policies, creating a health promoting and safe living environment. One of the important indicators of the mental health of the population is the number of suicides per 100,000 population. In the dynamics, a decrease in mortality from suicides can be observed in Latvia. However, Latvia is still among the countries of the European Union with the highest mortality from suicides. Bullying at school is a common form of emotional abuse that has negative and long-term effects on mental health. In general, the 2022 study indicates that approximately a fifth of 15 years old students have suffered from teasing in the past few months. According to the data of international study, these indicators in Latvia are among the highest among 45 countries and regions. The data of the 2023 study of the health affecting habits of Latvian youth, 19 years old, on the psycho-emotional state of the population in Latvia have slightly deteriorated compared to the 2022 data. And 50% of young people sometimes felt tension, stress, depression during the last months, which is 8% more than in 2022. Teenagers have a high self-assessment of nervousness and depression. The data of the study of the health habits of Latvian students show that in the group 11, 30 and 50 years old students in 2022, 31% of boys and 46% of girls had complaints of nervousness at least once a week. This, of course, was hit by the COVID pandemic and its consequences, like in all world. Significant factors affecting mental health are violence experienced in childhood, which can affect a person's life and health in adulthood as well. Young people who experience childhood abuse have lower self-esteem and more frequent alcohol abuse and suicide attempts, and more psycho-emotional health complaints. The promoting of 11, 30, and 40 years old who are overweight and obese is also increasing, which also affects mental health. In order to promote physical and mental development, all children need to engage in physical activities, including children with various health and development disorders. Unfortunately, in Latvia, some doctors and sometimes also sports teachers, when they come into contact with children who have disease or disabilities, prefer a recommendation to limit physical activity. Lack of information on sexual and reproductive health issues, such as prevention of unplanned, unwanted pregnancy, appropriate contraceptives, especially among groups at risk of social exclusion, often leads to early pregnancy or abortion. Currently, there is no health education in the curriculum in Latvia. And this moment okay. In 2020, the proportion of young people who started smoking at an early age has decreased. But on the other hand, the proportion of 30, 50 years old students who use electronic cigarettes is increasing significantly. Currently in Latvia, some opportunities have been created for young children with autistic spectrum disorder to receive professional and evidence-based help and rehabilitation. However, one of the limitations is that these services do not follow through to adolescents, which is the most important stage for training social communication skills. There's an acute and unmet need for support and assistance measures for young people with autistic spectrum and other social communication disorders. It is also necessary to provide support and education to parents whose children attend social skills training groups in order to promote the further retention and strengthening of the skills acquired in the group. And addiction to new technologies has a negative impact on both mental and physical health. Excessive passion for using new technologies causes various psychological disorders such as depression, anxiety, lack of sense of time, etc. Therefore, it is essential to provide public education about the risk of process addiction on their impact on health, paying special attention to children and young people. And eating disorders are also serious mental health disorders that cause physical health problems, and not only physical, psychological problems too. And the most common mental illnesses in adolescents are anxiety, mood, attention, and behavior disorders. And suicide is the second leading cause of death in young people age 24 years. Okay. And worldwide, due to the COVID-19 pandemic, the numbers of anxiety and depressive disorders grew. Depressive symptoms grew from a base of about 193 million people worldwide to 246 million, which is about 28%. Anxiety disorders grew from about 298 million people affected to 374 million, which is about 25% increase. That's a very low, I guess, I think. So there's a lot of challenges, including those that the children face outside of school, in the family, in society. So the school environment is a place where you can create an intervention to reduce difficulties. Yes, and currently the leading psychologist in Latvia who research, analyze, and look for opportunities to change the situation in the social-emotional environment of the school, offer to learn emotional intelligence through the process of social-emotional learning, in which students learn the ability to recognize and manage emotions, care for others, make good decisions, behave ethically and responsibly, develop positive relationships and avoid harmful behavior. Students develop the ability to integrate thinking, feeling, and behavior to achieve important life goals and objectives. So, yeah, and by developing social emotional skills, adolescents feel safe in the classroom, and an atmosphere of mutual support and acceptance is created for successful learning. Awareness of emotions and self-regulation abilities have a very significant impact on the quality of peer relationships, as well as ensuring well-being and success. More and more studies in Latvia confirm that by including social-emotional content in school, pupils' behavioral attitude and academic performance improve. And yes, you can see benefits of promoting mental health, that students have better academic achievement, students' self-esteem increases, their well-being at school employees improves, school environment are safer, relations among students is improving, and parents are more involved in school activities. Yes. Now I would like to hear from you what are the challenges of your countries. Maybe it's the same, maybe it's a little bit different. What is the challenges that you yeah. Can anyone share the challenges in your countries?
Hello, in Serbia, trends is the same. But in Serbia, we see increase of non-suicidal self-harm. Yes, many researchers said about that. And after that, many students have anxious, depression symptoms, nervousness, and other sort of addiction.
Yeah, self-harm, yes. I didn't
a non-suicidal self-harm is new trends. Increase.
Yeah, self-harm is in our country is increasing too. I didn't meant this, but it's yeah, it's go with depression and anxiety.
They connect with anxiety and depression.
Yeah.
Yes.
Connect, yes. In other countries, in Croatia, is there something different, or maybe you can add something?
So we are not following so closely the trends of mental health since we are in the adult education. But from what I know, that anxiety and depression are very often and mostly related to the school success. So the school system is very stressful for children, and they don't have the skills to cope with the stress and the amount of demand that is put on them. So there is a lot of youngsters who are leaving the school or do not want to go to school anymore because of the amount of the anxiety that it produces.
Yeah. Thank you. Is there Italians participating today? Okay. Yeah. It's many problems are common in countries, and okay, and let's go right now. Okay, and the role of mental health professionals working with students and staff in schools. Yeah, mental health professionals in schools. In our schools, there's support staff like school psychologists, social pedagogue, career counselor, nurse, special pedagogue who is working with children who have special needs, teacher assistant. The same teacher assistant is who is working with children with special needs too, helping teachers, and speech therapist. In our school in Jelgavas State Gymnasium, we have school psychologist, social pedagogue, career counselor, and nurse. Special pedagogues, teacher assistants, speech therapists are the staff who are in primary schools, not in secondary schools. They work more with little children and not with adolescents. Yeah, and yeah, school are in unique position to reach all children. All children and young people can benefit from school-based mental health support, in particular those with less supportive home environments or where families are under additional stress. Indeed, the school environment is not only a place of learning, but also an important source of friends, social networks, and adult role models, which can all have a significant influence on young people's development. Schools are in the unique position of being able to reach children and young people regardless of their personal circumstances or family background. Okay. Support staff play a very important role in Latvian schools. When schools have a support team, research shows that behavioral problems, symptoms of depression, anxiety, risky sexual behavioral, substance abuse, tobacco, alcohol and drugs, violence and teenage pregnancy, sexual transmitted diseases are reduced. Programs implemented in schools include mainly social emotional learning, learning social and life skills, conflict resolution, self-esteem, interpersonal and self-management skills to all students. Cognitive behavioral therapy and other approaches may be used for at-risk students. Such an approach can be implemented individually or in groups, as well as using different digital platforms. Cooperating between schools, families, and society is essential. It helps build a common approach to mental health promotion. Therefore, the mental health competencies of students and teachers need to be developed at different levels. Promoting of mental health in schools is currently one of the priorities in Latvia and around the world to ensure quality education from preschool to high school. The support team in schools takes responsibility for promoting the mental health of pupils and staff. And early intervention, it is essential to lay the foundation for good mental health already in preschool. Mental health promoting should be continued consistently in primary school and secondary school. And when mental health problems such as depression, anxiety, and self-injury or antisocial behavior may be more common. In Latvia, mental health initiatives can be implemented as direct teaching of skills in separate lessons specially designed for it, as well as they can be integrated into other subjects as part of a whole school approach. Important is teacher education. School staff must be properly trained to take care of their own mental health and that of their students. Because understanding of child and adolescents' development, social emotional learning, psychological well-being and vitality, the implementation of effective programs, recognition and resolution of mental health problems in collaboration with parents, colleagues, and other professionals. In addition, teachers themselves need to develop their own social emotional competencies, including empathy, conflict resolution, collaborating skills, and relationship building and self-care skills. Parents are one of the most important partners in promoting mental health at school. The school should support and ensure such collaboration to promote parental involvement and shared responsibility for promoting mental health in school. And a health promoting school is a school that constantly strengthens its capacity to give everyone the opportunity to learn, to think, live, study, and work in a healthy way through the school environment. School health promotion is any school-based activity that is undertaken to improve and or protect health and includes health education, effort to create a healthy environment and school policies. And you can see a health promoting schools is characterized by an approach that covers the entire learning environment, dividing it into 6 elements. First of all, school health policy. It's clearly defined documents or implemented practices to promote health and well-being, the physical environment of the school, its development, making the school building and surroundings safe, suitable for recreation and physical activities, school social environment, the quality of relationships between students, as well as between students and school staff. Individual health skills, implementation of activities that develop students' knowledge and skills in the field of health. Connection with community, building connections between the school and the students' families, as well as between the school and people in the community, by supporting health promoting activities in the school. And health services provided in or related to the school, providing healthcare and health promoting for students. Now I'm gonna ask you, what is your support staff in schools? What is included in the support staff in schools? Is the same like in our school, or maybe is some kind of differences? Svetlana, can you share?
Yeah. In Serbia, in regular school, secondary school, we have psychologists, not other staff, psychologist, and the teacher is very important, and class teacher.
Mm-hmm.
This is the important person who supports our students.
Class teacher,
And now we have a big training for all psychologists in primary and secondary school online about mental health.
Mm-hmm.
Because this is, we see that is a very important goal, and I'm one of trainer on that training, and they consist for two parts. The first part is online training, and the second is a visit in school when schools have problems with mental health, and our task is to help and support psychologists and teachers in that school to solve different problems.
Mm-hmm. You are going like supporting school psychologists, yes?
Yes.
Mm-hmm.
Trainer on that, one person from school district. This is advisor in Ministry of Education, and I'm external advisor for mental health.
Yeah. Okay.
In our district, every district have a different person who support.
Yeah, of course. Yeah, very good experience and good way to increase school psychologists' knowledge about mental health and
Yes.
practice.
Next week, I probably have a visit in school.
Okay. Okay. Yeah, and I guess it's very good experience for you, Svetlana, too.
Yes, yes. But
Yeah,
our school 2 years before very active in field of mental health, and we in the local community we start with many activities. In our city, we formed a team for mental health for adolescents on local level.
And which how many people are there in this?
5 people. 1 people from educational sector, 1 people from health sector, and 1 people from social sector, and from municipality too. From 1 person from youth office, we have youth office in our city, and
yes.
the fifth is a person from municipality, president of Skupština. President of city assembly is the president of that team.
And the goal of this
Our
group
goal is to help adolescents in our city to prevent problems with mental health, and we have some activities in April and May. And we have one small project with other non-profit organization who is coordinator on that project, and this project financed from Ministry of Sport and Tourism.
Yes, you have a very big and good experience in this solution, this problem of mental
And
health.
I am member that team, local team from educational sector.
Yeah.
And my experience is very different. I have a different role. I work in school with students, with parents, with teachers, and I have many activities in local community with other people, other teachers from other schools, other students. And it's a great experience, but problem is the same in every school, every secondary school.
Okay.
In our town, in our city, and in our country.
Yeah, very, very good, yes, experience. Okay, thank you, Svetlana, for sharing. There was a raised hand.
Me. Hello.
Yeah. Hello.
Hello. Hello. My name is Maria. I'm from Cyprus. I'm working in a private school in Cyprus, Nicosia. In Nicosia, Cyprus. We have similar system. We also have a school psychologist in our school too. We have two because we have two schools, one Greek and one English school. So we have one handling Greek school and one English school. And we also have teachers training occasionally about mental health by Ministry of Education and also from school psychologists. And we also participate in many seminars like Erasmus training, exchange, and etc.
Okay, thank you. Thank you for sharing. Croatia, what is your experience?
So we, as I said, since we are adult education providers, we don't have those requirements as maybe high schools and preschools have. So we don't have to have a psychologist employed. But we do have an HR office who is actually taking care of our teachers regularly and is making sure that they are well trained and that they receive the necessary support in order to deal with people in the classroom in order to guide them better. And we also send our teachers to Erasmus Plus training courses. And we provide a lot of activities that are focused on giving our students a safe place to experiment and communicate between each other. So we are creating like small community in our school with different activities such as book club or choir singing or hiking. And these activities all have the purpose of supporting individuals in their everyday life and nurturing mental health because it's giving people the sense of belonging, which is, I think, something that we lost in this fast-paced world that we are living. So this is something that we are trying to create around our community.
Okay.
Uh,
Yeah.
Jelena, thank you for these kind words, but I also have to emphasize that we are struggling with it because we kept a lot of online lessons, and to have community and to be able to get into, you know, everybody is in their small circle when working home, and we do miss it. And so it's important and relevant topic to us as well for the staff. Yeah.
Thank you, Anya. Thank you for sharing. Yeah. Now I will tell you what are we doing, and what is the tool for accessing and intervents to increase this mental health, our experience and the best practice. When school year started, the beginning of the school year is important, and we practice an adaptation day at school when children come to school to familiarize themselves with the premises, spend time together from beginning in an informal atmosphere, do joint activities that break the ice when children return from summer vacation, in order to successfully start communication with their classmates. And adoption day, it's good to start with this day because they don't need to teach math or history at the first day when they return from summer vacation. And it is very important not only for young students who started learn in our school from 7th grade, but in all classes, in all grades, because summer is very long in our school. In our country, it's 3 months. All summer, and it's good to take a easy day to feel better and to return to school. When 1 month has already passed at school, we invite children from each class to come to us with me, school psychologist and social pedagogue, for friendly talks, and we want to find out how they are doing at school, what their previous experience was, whether they have made friends with anyone in the class, etc. Usually, most children want to come to the talks. This conversation allow us to measure the average temperature in the classroom, whether the children are doing well or if there are any difficulties, and whether something appears that needs attention in the future. And it's not possible to talk to all the new 7th grade students, so we conduct a questionnaire about how they feel about the school, what their positive experiences are, and what they are dissatisfied with, and with not. And yes, and we are educating parents about the school's main goals, learning approach and assessment system, because it's important that parents knows everything about school that helps parents to help to them children, and in our school we have different programs that helps to both identify difficulties and work preventive. And I will talk about these programs a little bit to show. For me, it's very interesting that Svetlana said about this project where they help school psychologists to deal with some mental problems, but we have some different programs that we involved in our school environment and use it. EMU. EMU, it's like a not a bird. It's not a bird, but they chose this also chose this and it's a questionnaire and survey. EMI means 360-degree questionnaire once a semester on students' current needs and conflicts and potential conflicts. Yes, and this questionnaire, yeah, they do twice a school year, once a semester, and in this questionnaire is questions about how they feel in class with classmates. Is there conflicts in class? Is there bullying? The questions about their learning experiences and about family involved in learning process. Then we have statistical data, and the statistical data also allows planning of internal school resources to address difficulties and to support and needs and to support pupils. Yeah, we can see how many children need help and how many children say that they are not in the learning mood, that they struggle with some problems. And in this program, teachers got the materials, some methodical materials, and consult of external specialists and experts. Yeah, and yeah, and we can see in this that this questionnaire results shows us how many people didn't feel questionnaire, how many students feel in the learning mood, that they admit that everything is okay. How many students are in this balance mood, and how many students are in this mood and we need to help them to deal with some school stuffs or some mental health problems or some problems with families. And we can see arrows show us that is some kind of change from previous questionnaire, and yeah, and we can see how many how many students are answering questionnaire, how many teachers were spoke to the students, and yeah, and how many students need support from support team at school. This is a very useful instrument, and we are 2 years almost. Yes, we are this instrument. Okay. Second instrument is it's program mod. It's a program who is started in Norway, and it's in Norway, South Africa, Denmark, and in Latvia now in 80 schools. It's a program, motivational program for teenagers, and the motto started by Norwegian Olympic athletes after the Winter Olympic Games, with the aim of preventing social problems in society. The motto concept is based on the desire to create a safer society by strengthening the awareness and courage of young people, the courage to live, hear, and say no. And the motto concept is transferred for use in schools on the basis of cooperation agreement, and trainers in this mod program is people from different organization. They do it for free, and they come to school, they took this training program. It's approximately 6 training courses in the school year, and where the children is knowing better each other, and talk about things that is very important in their lives. And yes, yeah, this is it's a very good program in our school, and it's I guess it's like 4 or 5 years in our school now. And one more program is it's called Nekluse. In English, it's Don't Keep Silent. It's a social project whose goal is to reduce the level of bullying in Latvia, and is free solution for schools. And there is a survey to understand the situation and identify violence and bullying. Training for school staff offers this program, when teachers got some very useful materials and methodology for reducing bullying. And there's a individual help for the students. Students can write and to support specialist with a they can connect with a psychotherapist in this program, and the student may contact a professional outside the school to resolve interpersonal conflicts. Yes, this is free program and very good methodological materials for teachers. And yeah, what is your best practices in your country? What is this where you are maybe happy or and satisfied? How to reach students and talk about mental health and deal with mental health problems? No one want to share your best practice? What's the tools for accessing students' mental health?
In our school, we have annual program, preventive program, and we plan different activities from continuously from all school years. And this is different workshops. We realize them on class teacher lesson with class teacher for that grade. We have first, second, third, and fourth grade in secondary school, and every week we have one class and one activities. That activities adopt for different ages for our student, and cover different topics about mental health. For us, this is
every week one.
Every week, every class in the same grade have one activity and one usually workshops. And this is the good, because students loves group activities, preventive activities, and they have exchange opinion and exchange. They can see that all students have same problems, and this is good for them. And class teacher better recognize their students, and we together plan different measure for overcoming stress for specific students. If that students have a problem. For our school, this is the good approach, and we try to continuously use that methods.
And how long is this one
45
training?
minutes. 45 minutes.
45 every week.
Every week
one.
they have 45 minutes, but we have we have council of students in our school. This is the special bodies in school, and we have different activities with that students from each class in students' parliament. We have 3 students
Okay.
And
Very
the students have different activities with other students. That's the second way to best practice. And every year we have school year, we planned activities for parents and teachers. This school year we have 2 panels with parents, all parents in school. For each class we organize on the we organize on same grade. Parents from same grade, panel about mental health. And we have different workshops and panels with teachers. And this year we accreditate one panel about mental health of teachers. And we have one realization in December last year, and the second in September this year.
Okay. You are doing a very great job.
Thank you.
Yeah, thank you, Svetlana, for sharing. Okay. Yeah. And this is what I wanted to tell about. Because yeah, and this is the things that this is things that we are doing, and thank you for sharing your different experiences, and maybe you have some questions, some precise questions.
Thank you.
Okay. Thank you for your answers in chat. Can anybody send evaluation for? Serena. Maybe Serena will do this. Serena is. Okay.